In 2 days, we create the same amount of data that we created between the beginning of time and 2003. 90% of the data that exists today have been generated in the past 2 years. It took 8 years and billions of dollars to decode the first human genome. Today it takes a little more than a day, and it is soon expected to be a tagged price of $100.
The healthcare industry is now awash in data, from biological data such as gene expression, SNPs, proteomics, metabolomics, to more recently, next-generation gene sequence data.
Still, one day or another, your genomes, and again, you might have some kind of geographical difference based on culture, but the US, it is likely that you will have your genomes online.
Digitisation of patient-level data has caused an exponential increase in the enormity of data. The electronic health records are enhanced with data from imaging and test results, medical and prescription claims, and personal health devices.
The National Health Services here in the UK are increasingly recording health events and treatment modalities for all patients across all healthcare settings. And the UK government and health researchers are beginning to really see how to exploit this massive pool of rich data.
There is a big difference between big sets of data and information, and I think that's what our clients are struggling with. All of our clients have got access to big data, they've got huge volumes of data, and in fact they're overwhelmed with that data. The challenge is that they haven't got useful and accessible information.
There is a lot of adverse event data being reported in social media today. It's really not clear how to use those data. It's a big unanswered question.
Unexplained variations in treatment cost $600 billion to the US, but cause no difference in the outcomes. The need to understand prescription effectiveness has become vital.
Data from electronic medical records, from registries and claim data sets, they can all help improve the effectiveness of prescribing. Pharma companies really need to embrace this. They need to have a much more targeted approach to medical development, to medicines development. In fact, let's call it treatment development, by not just developing pills, but by also developing applications which can help make a much better prediction of outcome.
So how do we help physicians and help the patients themselves to manage the total disease entity?
This is where the true promise of the digital channels lies, as a means of engaging directly with patients and their families.
We all carry mobile phones as an extension of our left or right arm, and use it to frankly access a multitude of information, both personal, work-wise and so on. And of course a core component of that is the access to health information data.
By February 2012, 44% of mobile subscribers across European markets use smartphones. Research predicts that global mobile internet users will surpass desktop internet users by 2014. Pharma companies have started online communities to offer educational and motivational content, including games, videos, podcasts, articles, and recipes for patients of their therapeutic areas.
Everyone now has a smartphone. Why not to link the glucose monitoring with a smartphone? It will help. First, it will help the patient to have the good dose, because he can record his diet, he can record his exercise, and after that, the apparatus can make the calculus. Imagine that you are a parent and you have a kid which is diabetic type 1. So he's far away, he's at school, you are scared, you want to know how he's doing. With smartphone you can.
Well, how do you handle that data? How do you handle a situation where the external world knows more about your asset than you do? I think we need to be planning for it now.
We believe that the treatment paradigm is changing significantly, and that most pharma companies should be focusing on a broader array of what they provide to patients. We believe that they can provide a much greater value by developing tools and services, as well as white pills and drugs, to help patients get the medicine and treatment service that they require to take those medicines effectively and as directed, and to modify their lifestyle where required. And we believe that the savings to society would be substantial, and the trust in the industry would raise significantly.
These savings will release funds for new devices, diagnostics, services, and for the relatively few really new medicines.
How is Kinapse engaging with its client base on this agenda? And it's really around three main pillars. It's around the provision of advice, it's around supporting of the build, and then potentially going out to operate on behalf of our clients.
So digital strategy will help provide the framework for really understanding the opportunity, for determining the constraints, to putting it into the context of various other channels that exist for service, and then ultimately to allow for the future, which will increasingly be one which is digital.